and take a deep breath. No difficulty breathing. The nostrils are painted.
Peppermint.
Peppermint. Very good. Yeah, so his sense of smell is intact. Moving on from the nose, I want to assess the mouth. So just looking at the mouth, he doesn't have any blisters or lesions on the lips. The lips are nice and pink. There is no cracking noted. I once again would have gloves on before I touch the mouth, but I don't have gloves, and I do know this patient volunteered very well, so I'm going to go ahead and touch his mouth without putting on gloves this time. So I'll be looking inside the lips. Good. Nice and pink and moist. Keep your mouth open. Wide. Good, and lift up your tongue. Okay. All right, so back, in the back you can see the uvula is nice and pink. Underneath the tongue is also pink, moist, and veiny, which is normal. He's got a little bit of whiteness on his tongue, which can also be considered normal. Go ahead and stick out your tongue for me. Say ah.
Ah.
Good. So when I assessed his tongue, I was also assessing for cranial nerves 9, 10, and 12. And by doing that, I wanted to make sure that his uvula back there would rise, and it did. If you don't mind doing it again for me. Good. I just checked his gag reflex, which is intact. Sorry about that, but it does make you gag just by swiping back there. If you open up your mouth once more time. Yeah, sorry. Good. Yep, and I would say that his tonsils are about 1+. They're visible, but they're not very strongly visible, so about 1+. His teeth are about an ivory color, which is a normal finding as well. If I wanted to test his sense of taste, I would do that. Unfortunately, I will not be doing that today, but the ways I could test his taste to see if it was intact, I would test for bitter, sweet, sour, and salty. But we won't be doing that today. So, let's do that. If you don't mind sticking out your tongue once more. The tongue is midline. Can you turn it from side to side? Good. Be able to turn it side to side. Good range of motion for the tongue. Nice, good movement. Very appropriate, normal findings. Okay. So moving on from the tongue, now I just want to focus on the face. So I want to check for sinus pressure. So I'll check the front. Is there any pressure here?
Nope.
So no frontal pressure. Any pressure under here?
Nope.
Nope. Pressure at all?
Nope.
Okay. With the face, there's a few things that I'm looking at. I'm looking for the trigeminal nerve, which will be the light touch sensation on the face, as well as the temporomandibular joint. So if you don't mind, go ahead and open and close your mouth. Good. And this time, keep your mouth closed as I try and pull down. Good. So that is intact. Also, I want you to close your eyes, and I want you to tell me when you feel a light touch.
Now. 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 Now.
Okay. So his light touch sensation is intact, so his trigeminal nerve is appropriate. I also want to check the facial nerve, which is cranial nerve number 7. What I'd like you to do is I'd like you to raise your eyebrows. Okay, now smile. Smile without teeth. Frown. Okay, squint your eyes real tight, like this. Good. Blow up your cheeks. Very good. So his facial nerves is intact, which is a good finding. Looking at his skin on his face, it's normal toned. He has a little bit of pinkness and redness around his cheeks, which is normal findings. His skin feels nice and warm, dry. Slight a little bit of acne, but not a lot. Okay. Everything looks good along his face. So now what I would like to do is I want to move down to his neck. So things that I'm going to be looking for at the neck is I want to check out his lymph nodes, I want to check the trachea, and I also want to check the thyroid. So when I'm checking his lymph nodes, he's got several of them. So down, cervical chain, supraclavicular, so his lymph nodes are nice and light. They're soft. They're not hard. Nothing feels swollen, which is a normal finding. Did that cause you any pain or tenderness?
It did not.
So there's no pain or tenderness, so his lymph nodes are okay. Also, I want to check his trachea, so if you don't mind looking here. So I'm looking here and I'm looking the trachea. I can listen to his trachea. Just breathe normally. Breathe normally. Okay. So the trachea is normal. I could hear some high-pitched sounds, but those are normal sounds. No bruit is noted. Now I'd like to check for the thyroid, which I'll come back behind. The patient, I can kind of grab onto these muscles on each side and push the thyroid to the right side and also push the thyroid to the left side. Not finding any bumps. This time what I'd like you to do is I'd like you to take a drink of water as I push onto your thyroid. And swallow. Good. And do it again. Good. So I could feel the thyroid move up and down as he swallowed, but I did not feel any lumps on either side, and it felt symmetrical, which are good findings. Another thing that I'd like to do is I'd like to assess for the carotid pulse and also for the jugular vein distension. Best way to feel the carotid pulse is just one at a time and just light touch. Don't want to obstruct blood flow. Feels good, nice +2 pulses. Strong, regular rate and rhythm. Very good. For the jugular vein distension, it's best if the patient lies down on his back at approximately a 30 to 40 degree angle, which he is. If you could turn your head to the side. I'm looking for jugular vein distension. There is no jugular vein distension, but I can also listen for a bruit. So no bruit is heard. Normally I would check both sides, but today I will not be checking both sides. We'll just consider normal findings in both. If you don't mind sitting back up. And if the carotid pulse, if there was an indication, I could also listen to the carotid pulse for a bruit. But again, light touch because you don't want to obstruct blood flow. And there is no bruit heard. Excellent. Okay, so moving on past the neck, now what I would like to do is I'd like to focus on the respiratory system. The respiratory system, I like to start with the back first, so if you could turn around for me. So my patient, if you're able to turn just a little further around, yep, we're just going to have to... So what I would do is normally my patient would have the shirt completely off, but for now we're just going to kind of raise it up for the back part. So what I want to assess, if you could, is there a way you can squeeze?
That's a little over there.
Yeah. makeshift with a couch. So what I'm doing is I want to just look and assess my patient's back. I want to look at the muscle distribution as well as the chest wall expansion. So I'm looking at it. It looks symmetrical on both sides. And I would turn all the way around. Yep. Okay, so once I've done that, I want to just sort of feel for the chest wall expansion. I would place my fingertips at about T10, and I'd ask him to take a deep breath. Can you take a deep breath for me? Take another deep breath for me. Good. So my thumbs rose in symmetrically, which is an expected finding. What you don't want is one hand rising, or one thumb rising higher than the other dramatically. Also, what I can do is I can palpate my patient's back and look for any nodules or tenderness. I like to start with the spine first. Any tenderness? So no tenderness noted, and then I can, with just my finger pads here, go along where the lungs would be. Any tenderness? So no tenderness is noted. I can also percuss my patient's back. When I percuss the back, I will be looking for diaphragmatic excursion. And so where the diaphragm is, it should be dull, and the rest of the body should have good resonant sounds, but not hyper-resonant. I will do that in just a second. First, I'm actually going to do assess for tactile ephremotus. So how I assess for tactile ephremotus is I will place, using the palms of my hands, up on my patient's back, and I'll have my patient say 99.
99, 99, 99, 99, 99.
Good. So you should have a little bit higher vibrations up top. That is normal as you work your way down. But it shouldn't be it shouldn't be stronger vibrations any particular area. And if there are stronger vibrations, it could be a potential sign for pneumonia, and then no vibrations at all could be a sign of there is fluid in the pleural spaces or air there. So now I'd like to percuss for the diaphragmatic excursion. So I'll start. Is there a way? Yep. Sit up a little bit straighter. Thank you. I'll start kind of beneath the scapula, and I'll be. So here's where I got dull area. So actually, what I'd like you to do is you're going to take a deep breath and hold it. Okay, good. Take another deep breath. Hold it. Good. You can breathe normally. So from about here to here is where I have the diaphragm, where I felt dullness. This is anywhere, a normal finding is anywhere from 3 centimeters to 5 centimeters. However, it can be larger, more like 7 to 8 in a well-conditioned person. This looks a little over 5 centimeters, which is good, and he is very healthy patient, so I would expect that from him. And I would test that bilaterally on both sides, but today I will not be doing that. So then after I percuss and I check for diaphragmatic excursion, I can also percuss down here, very light touch. Down here, if he had any pain, he would, with his kidneys, he would probably be jumping off the couch. But there's no signs of kidney problems, so I'm not too worried about that. Now what I'll do is I'll listen to his auscultate for his lung sounds.